Today I'm tasked to discuss the informed consent for invasive, diagnostic, and therapeutic medical or dental procedures policy. The purpose for this policy is to verify that the patient has been fully informed of the required components of the informed consent. Procedures which require informed consent. Invasive procedures, including all operations with or without the use of anesthesia. So in AHS, we have incision and drainage, excision of the wound, suturing, pap smear, and some of the dermal procedures like cryotherapy. All dental procedures, HIV, hepatitis B, C, and HTLV testing when performed for screening purposes, and X-ray for pregnant or suspected pregnant women. So what is an informed consent? Prior to the performance of invasive and diagnostic therapeutic procedures, the patient or legal guardian who is authorized to consent on behalf of the patient must be told about the procedure, the inherent risk, its benefits, alternative methods of treatment and consequences of non-treatment, any expected results or outcome of the treatment, and the name of the physician or dentist. So what does the policy says? The physician or dentist who is to perform a procedure for which consent is considered necessary is responsible for obtaining consent and ensuring the relevant information is provided to the consent giver in a setting conducive to independent and reasoned decision. Delegation of duty to disclose information for purposes of consent may only be given to another physician or dentist capable of answering questions regarding the procedure or the implications of the procedure on the particular patient. So this presumes that the physician or dentist giving the information is familiar with the patient's history, especially the medical history. Responsibility for procuring valid informed consent remains with the attending physician or dentist. The date and time at which procedures requiring informed consent is executed shall be clearly documented in the space provided. The consent shall be valid for 30 days upon execution until revoked or until procedure is completed. If the procedure is not commenced within 30 days of execution of the form, the patient must sign again to give his informed consent. For dental services, the consent to treat applies all subsequent visits as long as treatment plan does not change. So here's the procedure. The physician or surgeon or dentist or the physician designee is responsible for assuring that the consent is informed and appropriately signed. The patient or authorized person has the right to an explanation of the consent form and the opportunity to read the form and to have any relevant questions answered. The patient should be assessed as being oriented to person, place, time, and not receiving mind-altering medications. So the informed consent is usually taken when before performing the procedure or before any anesthesia. The patient has the right to put a line or mark, a section or phrase of consent form which indicates patient or guardian exceptions to consent. A consent form is required for specific interventions as a record of patient's understanding and agreement. The completed form becomes a part of the patient's health record. So for HS, you are sending the completed form to the HIMSS. In accordance to local law and cultural tradition, only procedures involving reproductivity in female patients require informed consent of the husband or legal cultural guardian, regardless of age. Consents for minor, 18 years old or less, must be signed by the parent. Any alteration to a completed consent must be signed and dated by the consent giver and the attending physician before intervention commences. Notation for alteration and reason for it must be entered in patient's health record by the attending physician. Consent form must also state the list of names of the physician or surgeon dentist or the team who may participate in the procedure. The names of the procedure must be written on the consent form and should be legibly printed and must state the exact location of the procedure, like left hand or right hand. So this is our HS informed consent. This is the front page. So first we will put the patient sticker on the box, and we should state the name of the physician and the procedure, and then the physician name and stamp and the date below the consent form, and patient's name, signature, and the date, and patient's MRN number should be placed also below. At the back of the consent, if the patient is a minor, the representative name and signature and the relation to the patient must be stated, and also the date should be written. Below is the witness name, which is the nurse, the ID number, the signature, and the date. Okay, that's it. Thank you. Hope you learned from my presentation.